is a common disease that affects muscle control. Parkinson's disease affects about 500,000 people every year. The symptoms of Parkinson's disease are easily treated. This patient education program will help you understand Parkinson's disease and how it can be treated. Anatomy. The brain is the control center of the body. The brain controls movements, sensations, feelings, personality. The right side of the brain controls the left side of the body, and the left side of the brain controls the right side of the body. The brain cells that make the brain are called neurons. If a neuron dies, a new neuron will not grow in its place. Most other cells in the body are replaced with new cells if they die. Chemicals called neurotransmitters help neurons talk to each other. When neurotransmitters are balanced, the brain functions smoothly. Dopamine and acetylcholine are neurotransmitters in the brain. They control movement. A small area in the base of the brain makes dopamine. This area is called the substantia nigra, or the black substance. The causes of Parkinson's disease are not known. However, we know that in people with Parkinson's, neurons in the substantia nigra slowly die off. This causes less dopamine to be made. With less dopamine than normal, there is less dopamine than acetylcholine in the brain. This imbalance causes the symptoms of Parkinson's disease. Symptoms. Parkinson's disease usually affects people around the age of 60. It affects people differently. Some people have almost no symptoms, and others have a lot of symptoms. The first symptom of Parkinson's disease is usually shaking or tremors. Tremors are often in the hands or arms, but they can also occur in the legs, feet, or jaw. People with Parkinson's usually shake when the body is not moving or at rest. The shaking normally goes away when the part of the body that shakes is being used. Tremors usually stop when the person is asleep. Parkinson's patients may have muscle stiffness in the neck, shoulders, or arms. It can make it hard to bend the legs or arms. Over time, muscle stiffness may cause muscle aches. In advanced stages of Parkinson's, muscle stiffness can result in a stooped posture. Parkinson's disease can cause balance problems, which affect the way a person walks. This could cause the person to fall down a lot. Bradykinesia, or slow movement, causes Parkinson's patients to shuffle their feet when they walk. It also takes extra effort to start moving. Unconscious movements, such as blinking or facial expressions, may also be slow. Slow facial expressions can lead to a condition called poker face. This makes it so the person shows no emotions in his or her face. Bradykinesia can eventually make it impossible to swallow. When this happens, the person might drool. At its worst, bradykinesia can cause freezing. This is when a person feels like he or she cannot move. Freezing can prevent a person from getting out of bed or eating by himself or herself. Additional symptoms that are less likely include depression, personality changes, dementia, difficulty sleeping, problems speaking, sexual complications,